Thank you, Kevin, and thank you, Mitch. I really appreciate the opportunity to be here. For me, this is really important because I'm a healthcare professional, and I have been a nurse for many, many years. And I can tell you I have witnessed what CPR can do. I have seen that we've been able to save lives in a hospital setting and seen what people in the community have been able to do to bring people into the hospital setting with the opportunity to save their lives because they've known CPR out in the community. So it is critically important as we think about this. And I do want to thank our partners. You know, the American Heart Association, they're an old partner. We work together on many projects because we know in the state of West Virginia, you know, we are plagued by heart disease. We have significant heart disease, and we know that it's important that as a state that we begin to address that heart disease, recognizing that if people have it, there's a risk of a sudden coronary event, and therefore could very well be a need to do CPR. So I thank Kevin and the folks from the American Heart Association for their partnership. I also want to thank UniCare Foundation and Mitch. We do have a good partnership, and we are all interested in the health and well-being of the people in the state of West Virginia, and I think it's critical that we do this together because we all know what at stake, and that's people's lives. You know, today's a free event. We know that there are 350,000 out-of-hospital cardiac arrests in the United States every year. And of course, the leading cause of death requires the leading issue that we have here with cardiac disease is the leading cause of death, and therefore CPR is critical for us as a state to know and to understand. We can't wait for professionals. We have to be on top of it. Just as a show of hands, how many people in this crowd know someone that has heart disease, some sort of heart disease? Okay, if you do, if you raised your hand, you need to be here learning CPR. If you raised your hand, because there are so many people at risk in West Virginia, and we don't know, quite frankly, it's a silent disease. There are many individuals at risk and that we don't even know about, which makes it even more critical for us as a state to focus attention on this very important event today, which is learning to save lives. We know that in the state of West Virginia, I'm going to give you some statistics that everyone knows, but I'd like to bring everyone's attention to them every time I get an opportunity, because these are statistics that really should make us all concerned. And we know we need to change these statistics, but until we do, we also know there are many people out there at risk. We're 50th in the nation in terms of diabetes. We are 49th in obesity. We are 47th in physical inactivity. We're 48th in high cholesterol, which we know leads to heart disease. 50th for high blood pressure. So these are things that say to us as a state, we have many, many people at high risk for a cardiac event. And if there's a cardiac event, it's critical that we know how to do CPR. If you have a family history of coronary artery disease, then you know that you're at risk. But what about the people out there that don't? I mean, there are people that we see in the healthcare system that the first time we see them is a time when they're having a cardiac event or even cardiac arrest, and there was no family history. They weren't a diabetic. They didn't have known high blood pressure. So we all need to see ourselves as at risk. We all need to recognize there might be someone in our home, someone in our family, someone at our church, someone at a sports event that could be in need of these type of services, and we need to all recognize this as a call to action. We might be saving the life of someone we love, but we also might be saving the life of a stranger, and that's important too. We have to start today. We want to create a healthier West Virginia, but it isn't just about creating a healthier West Virginia. It's also about helping each other and protecting each other and doing what we can if an event does occur, and for us to be ready to take action. I believe everybody here can take action. I believe the people in the great state of West Virginia will take action and will do what's necessary to save their fellow citizens, but we need to be trained. Everyone has emphasized, I'm not going to talk about it again, it's a simple two-step procedure. Let's learn it today. Let's be ready. Let's help those folks in the healthcare system so that when they get that person in the hospital setting, we've already done our part. I also now have a proclamation from Governor Earl Ray Tomblin I would like to read, and if I could have Kevin and Mitch come up. If you all will just, I'll read that. So this is from the Governor Earl Ray Tomblin, whereas cardiac arrest is one of the leading causes of death in America, with 350,000 out-of-hospital cases occurring each year, and whereas immediate cardiopulmonary resuscitation can double or even triple a person's chance of survival. However, only approximately 46% of people who experience out-of-hospital cardiac arrest get the help they need from bystanders before professional help arrives, and whereas Hands-Only CPR utilizes compressions without mouth-to-mouth breaths and is recommended for use by people who see a teen or an adult suddenly collapse in an out-of-hospital setting, and whereas Hands-Only CPR can help residents save the life of someone they love, as 70% of out-of-hospital cardiac arrests happen in homes, and whereas the West Virginia Department of Health and Human Resources, the American Heart Association, and UniCare Health Plan have partnered to provide a day of hands-only CPR training. Now, therefore, be it resolved that I, Earl Ray Tomblin, Governor of the State of West Virginia, do hereby proclaim September 28, 2016 as Hands-Only CPR Training Day in the Mountain State, and commend those receiving training on this day, and urge residents who do not know CPR to consider receiving full training now or in the future to improve health outcomes for those who experience an out-of-hospital cardiac arrest. In witness thereof, I have thereunto set my hand and caused the great seal of the state of West Virginia to be affixed, done at the Capitol, city of Charleston, state of West Virginia, this 28th day of September in the year of our Lord 2016, and in 154th year of this state. Thank you all for being here. The governor certainly is very focused on the health and well-being of our citizens. We believe strongly in the DHHR that we need to be talking about this and doing things, and it's exciting to be here today because we are doing something, and I suggest everybody here sign up, Hands-Only CPR. Thank you very much.